All right, well, let's get to it. You've heard about Botox parties, right? Where women and men get together for wrinkle-banishing injections. Well, it's a party here on Colorado and Company today because we're going to show you how simple and easy it is to get rid of the wrinkles with Dr. Robert G. Fante.
And Botox is just part of what Dr. Fante offers. He teaches the art and science of cosmetic and reconstructive facial and eye surgery to doctors from the U.S., Europe, Asia, and South America. He practices what he teaches right here in Denver at the Fante Eye and Face Center. Dr. Robert Fante joins us now with Jenny. And Dr. Fante, tell us why Botox has become so popular.
Botox is a great thing, Mark, because it really provides for a relaxed and natural appearance for people. It relaxes muscles and makes their face look better, a little bit younger, and more attractive.
Gosh, who would want that?
Yeah, I know. Who in the world would want that? Of course you have Botox, but you have some other, non-invasive, non-surgical, I guess I should say, treatments and options at your office that you offer.
That's very true. We have various kinds of lasers that can improve the quality of your skin and the appearance of your complexion. Also, there are injectable filler materials that will take out some wrinkles, make lips look a little nicer, take away some of these deeper creases.
That's what I was talking about earlier. Right here, a little here. Right here.
Yes. Well, both of you ladies are beautiful, and Jenny, I have to ask you, why did you decide to use Botox?
Well, truthfully, I think that I was probably impacted by a commercial for it.
There you go.
And I thought along the lines of just the fine-tuning. And this seemed easy, and Dr. Fante made it easy, so.
Cool.
What results do you expect to achieve? What are you hoping for?
The first time I did it, truthfully, it was really almost perfection. I mean, I was like, wow, this is incredible. I probably sold 5 of my friends on it immediately.
Wonderful.
So, I'm not expecting perfection along those lines. It's just that it helps to dissipate some of the finer creases.
Yeah.
Dr. Fante, why don't you go ahead and get going and tell us what you're going to be doing here.
Sure. Well, Jenny and I have spoken beforehand, and so we have a pretty good idea what she would like. She would like to have some improvement in wrinkles around her eyes and her forehead and a little bit in her upper lip as well. And so we've got Botox prepared for that purpose.
Perfect.
And
now, how long does Botox actually last?
Lasts about 3 months, sometimes 4, sometimes a little longer for certain people, but somewhere in that neighborhood.
So you need to do it more than once.
You do need to do it. Most patients have it done about 3 times a year.
Okay.
And that seems to be adequate to give them what they're looking for. So I'm going to take off just a little bit of makeup with alcohol. Okay. And then this is the finest needle that they make. And we'll be giving small injections.
Okay.
So you can close in as much as you want, I guess.
Now, and people always talk about, does it hurt? And Jenny?
Jenny, you can speak to that.
Yeah.
No, it doesn't hurt. It really doesn't.
The needle's in.
The needle's in.
Wow.
The needle is in.
And there wasn't even a little hesitation or anything from her.
No.
My goodness. Why? I mean, I know you're actually getting Botox right now as we speak, so I don't, if it's going to interrupt anything, I just want to find out, why choose Dr. Fante over everyone else that's out there?
He came highly recommended to me from a client of mine, and then when I met him, we just had a good rapport, and I had it done by somebody previous, and Dr. Fante was far superior to the other doctor, and I liked the results, and I liked Dr. Fante.
Wow.
Thank you, Jenny. That's nice.
He didn't pay me to say that, by the way.
Dr. Fante, how often would you do this procedure?
I do it every day, practically, then I'm in the office.
Yeah.
Okay, Jenny, I'm going to give you a little bit in your forehead now.
How instant are the results?
Well, they're not instantaneous. Okay. It takes typically somewhere between 2 to 5 days before people see the full result. And then it lingers, as I said, for about 3 to 4 months. And so people, for example, Jenny at this point will be looking good by Saturday.
Wow. Yeah. And what is actually going on underneath her skin right now?
Well, the injections go underneath the skin, and they will very quickly bind to certain muscle receptors and block a neurotransmitter from being able to activate those muscles quite as much as they normally would. That process will, as you can see, there's a tiny bit of bleeding, but not very much. I hope that didn't bother anyone.
No.
Yeah.
Doesn't seem to be bothering you.
Yeah, are you feeling okay, Jenny?
Yeah, I'm fine.
Yeah. She's
no
doing
trouble
well.
at all.
She's doing well.
Now, Botox, truly, if you think about it, it's an art, Dr. Fante, because you have to know exactly how much to put in so someone can still look natural and still have facial expressions.
Well, that's
true?
exactly right. I mean, there's a lot of experience that goes into this. I've been
Right.
doing Botox injections now for about 17 years, and we started out with some other reasons for doing it, but now we do an awful lot of cosmetic injections, and by doing it so many times on so many people, and as well as doing the surgery that deals with the same muscles, I have the ability to know pretty much where to put it. So,
With so many different options
I'll
out
give you a
there,
little bit here now.
how do you, what are the determining factors when you're working with a patient, a client, in determining what procedures you'll go through?
Well, it depends very much on what it is that they desire.
Yeah.
Some women or men desire a very mild correction and want only something subtle done. Other people do want dramatic improvement. And so we try to tailor it toward whatever their desires might be.
Wow.
That is
She's
amazing.
getting them right,
getting
right
right
in
in
the
the
chops
lips.
right
I
now.
know. And
It works great in the upper lip for those vertical lines.
Oh,
Many
okay.
women get vertical lines in the makeup, or particularly lipstick runs up the lines, and they really don't like that. And we have to be very gentle with it in the lip, because too much will take away some facial expression, and that's not what we want at all. Jenny and I know each other enough to know that she doesn't want to look like she can't express herself, only that she gets rid of some of the telltale signs of facial aging.
And that was one of the things I've always heard, that, you know, like, oh, if you get Botox in, it like freezes up your forehead and you lose that, but it's...
That's not true. Only if much too much is injected do
Yeah.
you have a frozen forehead or a frozen eyes.
Yeah.
If it's done properly, it just looks more relaxed and natural.
Now, on a consultation, someone can come to you and you can suggest, of course, where they would need Botox.
Oh, absolutely.
Okay.
Absolutely. Speaking of that, I would have to suggest that Mark
Yes,
could use
sir.
a little bit of Botox, say right out here, for
Okay.
example. Right there.
Should
I think
just
we have
slip
enough
into the
if you
chair
want to slip
during
in.
the
Are you
commercial
going
break?
to? Oh my gosh, what do you think? You want to?
Do it.
Very good.
Saved by the bell. We gotta go.
Whether you're thinking about Botox or something more dramatic, Dr. Robert Fante is recognized internationally.